Across Nigeria, residents in need of medical care throng hospitals and clinics in hope of healing, but for some, the expected care goes awry. From misdiagnoses and surgical errors to delayed treatment, reports of medical negligence have become an alarming part of the healthcare experience.
When I did the operation, CS for my baby, it was cotton wool that they forgot. They had to go and start washing, evacuating my medicine again before they asked me, when did I do the operation? I say, look at what is causing me bleeding.
According to health experts, understaffing, inadequate training, poor record keeping, and limited accountability are major contributors to these errors.
When you don't have systems that are being enforced in order to minimize the errors that usually lead to negligence, it's likely to happen. On the side of, medical practitioners, there are so many contributing factors. I'm not saying that they're always without blame, but there are things that make it more likely for medical negligence or errors to happen. We're overworked, remuneration is poor, doctors are going on strikes, nurses, lots of healthcare workers. So a mind that is not rested, and especially for me, as a mental health personnel, we see the effects of burnout and all of these things on a person's performance.
Many residents of the country have lost trust in the health institutions, fearing that reporting negligence will be futile.
They feel that they won't get justice because nobody has been prosecuted. There is nothing, we have not had any case except the one that happened recently in Lagos.
There is a big reporting system that is easy and accessible to the people. It will help to, uplift the standard of medical care generally. Everybody will sit up.
However, there are concerns of weak enforcement of existing laws that protect patients' rights, ignorance and rare sanctions, and many facilities operating without robust patient safety mechanisms.
The law has made provision that when a case like this happens in this type of matter, you could go to court. It could be a civil matter. There are matters where it could be criminal, liable. And then there are matters where you could actually refer them to the medical and dental practitioner disciplinary tribunal, where they could bring the doctor, the hearing doctor, ask questions during the investigation, and they could make a verdict.
While medical negligence remains a silent crisis in Nigeria, patients and families continue to bear the consequences. But stronger enforcement, better reporting systems, and greater public awareness, according to experts, are crucial if change is to come. For now, many Nigerians continue to hope that the healthcare system will live up to its promise of care and not harm. In Abuja, for News Central, Aishat, Salihu.
Aisha, it's good to have you here. You did that report earlier, but just tell us, you had to go into the hospitals, you met some of these people, some of them are still. Why is it that they're afraid of reporting some of these cases?
I would say the issue with medical negligence is multifaceted. Why am I saying this? For many people, they would tell you that coming out to say there was, say, a medical error or negligence on the part of the practitioners, it's just like futile. Nobody is going to address it. But then it also goes a long way to the fact that people do not even know that they have rights. They have the patient's right to pursue, look for legal redress in cases where harm has been inflicted instead of care, but harm. So apart from that, and also the hospital system itself. So I was speaking with a doctor and then she mentioned that, okay, so when people report these things, how would you expect a medical officer to report perhaps a senior colleague that has inflicted harm, that has perpetrated medical error on a patient? It's more like a cult. So they're all protecting themselves. And these are the issues that kind of disallow these things to be corrected in the medical system.
And then that fear of victimization.
Right.
So, but when you mentioned something, and I think this is the last question I'll ask you, the question of patient rights, or which is also citizens' rights. The citizen has a right to medical care. What are these patients' rights and what do you think can be done to ensure that people get to know their rights?
I would say for patients' rights, patients have the right to information. Many a times you see some of these medical practitioners, they kind of hide the information from you. They don't really want you to know what is going on. And when you even do inquire, it's more like you don't know what is going on. You don't know how we practice this. So just let us do our thing. It's as if you're disturbing them. But I think when people know that they have the right to inquire and they have the right to pursue legal redress for in cases where there has been harm, and then when even the hospital system kind of encourage patients to come forward to say, this particular doctor did me wrong, this particular doctor did this, and then the Medical and Dental Council of Nigeria also needs to step up, whereby when cases come to them, there should be thorough investigation. At least it would encourage more people to come out and say, this is happening, and then justice is seen to be done.
Thank you so much. Aishat Salihu is a health correspondent here in Abuja. Thank you so much, Aisha.
Welcome.